A few years ago, we started working at a free health clinic for patients largely without health insurance. Since then, we've been really interested in health and policy. From there, we got involved with RDLA.
Because of family experience with liver-related diseases, we are deeply passionate about advocating for diseases such as hepatitis B. Because of that, we are actively involved with Join Jade, a global campaign for hepatitis.
We proposed hepatitis screening and linkage to care in California for healthcare providers to offer testing and follow-up care if essential to adults at increased risk of hepatitis in California.
We believe that using our voices is a step forward,
and we encourage the youth to come forward and join us.
My name is Caroline. I'm 18 years old, and I'm the lead youth ambassador for the National Advocacy Program for Narcolepsy Network. I was diagnosed with type 1 narcolepsy, which is narcolepsy with cataplexy, when I was 14 years old.
I have the lifespan, the voice, the physical and mental capability to be an advocate and fight for myself and others. The ones that I speak about the most often are the Newborns Screening Saves Lives Reauthorization Act and the Creating Hope Reauthorization Act. And I need to do that. I need to fight until everyone has the treatment and the cure that they deserve and they need.
My name is Grant Bonebreak, and I'm a member of YAR. I started advocating for legislation and research funds at age 14, about 2 years after my diagnosis. I was inspired to advocate after I went to my first ever Alport Syndrome family meeting. At that meeting, I met people with my rare disease for the first time, along with leading researchers. What really resonated with me at that meeting was that we were the first patients those researchers had ever met. So after that meeting, I started advocating and raising money as much as I could to spread awareness and pass bills in the House of Representatives. We have now 94 co-sponsors for the Living Donor Protection Act, a bill that I've helped build momentum for since 2017. This is important to me because it provides insurance and employment protections for people like my brother who are willing to donate their organs to save others. I've learned that policymaking is definitely best shaped by those who it affects. It means much more that way.
Hi, my name is Zachary Berger, and what inspired me to be an advocate for lymphatic malformation is that I suffer from the disease, and through my partnership with the Lymphatic Education Research Network as being the Texas Youth Ambassador, I've been able to be a voice and spread awareness for the disease by raising money for research and talking to government officials. Thank you.
Advocating for me isn't just making a change for myself or for even my state. It's making a change for the entire country and for every single person living with a chronic illness or disease and being the voice for them. I've met many people along my journey and their stories are amazing, and it's what gives me the fuel to keep going and keep changing things to help every single one of us.